Very good morning to all of you. Thank you, Dr. Rani. This is a talk which is not purely clinical, but at the same time, this is about my experiences as a pediatric ophthalmologist in dealing with special kids and the realizations which I have acquired over some time. So, multidisciplinary integration of rehabilitation strategies in children with special needs. Children with special needs was always an area of special interest. So previously what I used to do was we used to get referrals from across Kerala for children with special needs, especially autism, Down syndrome and cerebral palsy. And they used to be evaluated at my hospital with a pediatric optometrist and an ophthalmologist. So I got some opportunity to work in close association with a institution called National Institute for Physical Medicine and Rehabilitation, which is based in Thrissur, which is a Apex Institute for Rehabilitation for special kids under the Department of Social Justice, Government of Kerala. So when I started working there, what my experience was entirely different, because instead of seeing children in the in my clinic, I was actually a part of a team which looked onto the child on the real time, which consisted of developmental pediatricians, occupational therapists, special educators, social worker, psychologist, even ENT specialist, and many other specialities. So this has changed my outlook as how we approach these patients, and it has helped me to understand their ability and disability in a holistic perspective. As ophthalmologist, I would like to say we have a very limited view or very limited understanding of what the patient goes through or the family goes through. So each session of OT or occupational therapy is very much linked to the visual demands of the child. So instead of having a 6-monthly visit in which you see the child for maybe 15 or 20 minutes, if you are there with the occupational therapist and being able to monitor the progress of the child, and also to provide suggestions, because most of the children, they do improve in their cognitive status also after improvement in the visual outcomes. And so it has helped me to improve the quality of care delivery with improvement of rehabilitation outcomes. So we used to use many scales for assessment of, here I'm talking about autistic spectrum disorders. This is the Indian scale for assessment of autism. It has 40 test items in 6 domains: social, emotional, speech and language, behavioral patterns, sensory aspects, and cognitive component. And believe me, each of this has some bearing on the visual aspect as well. So a child coming with this kind of assessment, and if you look into the specific points, we can actually find out that we have a lot of things to contribute as ophthalmologists. And another scale which we use usually is the CVI range. So I started using this actively for past 1 year. So in the cerebral visual impairment also, we have different classifications like phase 1, phase 2, phase 3, depending upon the visual behavior of the child. This is gathered by interviews with the caregivers, observation, and face-to-face evaluation. So now what I do is I actually plot each child's observations in the CVI range and classify them, and then follow it with a CVI resolution chart to determine environmental considerations that should be implemented for further visual development. So this is the CVI resolution chart. All these are freely available in the net. Basically, what it happens is it helps us in a systematic, holistic evaluation of a child and the family, and the kind of interventions which can be feasible in to the family. Because it's not always that once you see the child and do this, do that, they may not be able to follow it up thoroughly, though even if they want to. So this has resulted in more dedicated monitoring of the patients, and this has also brought a lot of satisfaction to me as a pediatric ophthalmologist. So this is what I wanted to share with you as something which I have done more thoroughly in the past 1 year. Thank you.